So again, like we said, we're always assessing, and so the idea here is we're holding intention to assess joints and see if there's any joint that's got tension in it that wants to unwind. And there's two ways that I do an assessment. I didn't really talk about it yesterday. I mean, there's the sort of obvious way to assess, which if you just look up Willow's body, for example, you see there's an asymmetry in the hip. A little bit. This hip is a little higher than that one off the table, right? And then, you put your spine looks pretty straight, and that kind of thing. But then the other way that I assess is, the only way I can really describe it is, I say I sort of cast my view up and down the person's body and just see where my eye is drawn. See what looks interesting. And when I do that with Willow, I get called to this hip right here, the hip socket. So you know, a lot of people say, "Oh, my hip hurts," and they point to here. Mm-hmm. What's really hurting when they do that? Exactly. And there's probably some muscle attachment or tendon or something of the sort. But where do people feel the hip socket? The hip joint? Yeah, deep inside here, right? So this isn't all the muscular attachments on the greater trochanter. This is more the socket itself. Now, if it were up a little bit higher, even just an inch higher, I'd wonder about something like with an ovary or fallopian tube or something like that. But this is more, feels like it's more right there. So then I would check this, I would sort of double check that with checking the rhythm. You feel like you might be a little tired this morning. Amplitude of her rhythm's pretty low. At least down in her feet. We'll talk about listening station in a second. I just want to. So let's assume that you want to unwind that hip then. So there's two ways to do it. There's the football linebacker way, and then there's the way everybody else does it. So how they teach a lot of ways to do the unwinding is you take gravity off the limb, which means you have to pick up the limb. So you pick up the limb like that, and then you tune into it, and you put little test motions in and see how it wants to move. So she wants to go into like an external rotation a little bit. So I'm putting my awareness in that acetabular in there. Continuing feeling that. And then they'll often get to a place where it just wants to stop and not move anywhere. And you just hold it and see what happens. And a lot of times you'll feel the body start to go, shake a little bit, or tremor a little bit. And that's what's called the therapeutic pulse. And then often after that it goes, just relaxing. And you go down into a little more external rotation. So sometimes this takes 15-20 minutes. Okay? So if you're standing here like this, holding this leg for 20 minutes, that can be a hardship for you. Mm-hmm. And especially if the table's not the right height. You have to bend over a little bit to do it. And that wouldn't be good for a long period of time. So a second way to unwind the hip would be to, I usually will put one hand on either side of the joint. So for the hip, that would be one hand right here, and the other hand could be right here. And then I put my awareness in the palms of my hand, and then palpate down into the tissues. And we'll practice that maybe later today, I think. And then again, just tune into the tissue and then invite it to start moving. I put little test motions in, and again it starts to They didn't completely unwind it the other way. There's still more unwinding to do in there, and it's wobbling around. And so what I'm doing with my hands is following the movement the tissues are doing. Kind of like if you're following somebody's lead when you're dancing. And oftentimes the patient feels like you're moving them, but you feel like you're just following their motion. So it's interesting. Do you feel anything moving in that head? Following around moving a little bit?
Well, when I first lay down, my back was hurting pretty bad, and I noticed in a couple points where a wave where that pain stopped. But this is just motion, and like I don't notice it.
Pretty slight. And again, usually it will get to a place where it wants to stop, and then so it comes and stops. And then oftentimes you feel kind of going like that, and then that just fades away still, and then often it, yeah. And we'll talk about the signs of tissue release. How do you know when the tissue's released? So that's how I would unwind your hip. So for an ankle, there's again. There's two ways to unwind the ankle. One would be you can put your hand on either side of the joint. So for an ankle, I would like cup the foot and hold the medial and lateral malleolus here, and just let it unwind. Now, ankle is a universal joint, right? So it's two joints in one. So you've got the part of the ankle that does this, and that's the what? Talo, yeah, that's the part that's up in the mortise. So that's the, and the mortise is made up of both the tibia and the fibula. Mostly the articular surface is the tibia, so that's like the talotibial joint, I'm going to call it. But then you've got this motion here, and where does most of that happen? The talocalcaneal joint. Right? So the ankle can go around in circles, but it's the two joints working together. So it's literally like a. If you've ever crawled into your car and looked at where the drive, if you have a rear-wheel drive, most cars are front-wheel drive now, but where the drive shaft goes into the differential, there's a universal joint there. Or how if you've ever been on a sailboat, how the lanterns are mounted on the wall of the sailboat. It's called gimbal mounting. The same as universal joint. Have you seen those? You know what I'm talking about? But it lets the lantern rock this way or this way. So one is on an axis this way and one's on an axis this way. So it's the same kind of motion. And so when you're unwinding an ankle, you got to think about the two different joints. That's what I'm getting at. So another way to unwind the ankle would be to go on either side of it. So you could go like this and then follow it that way too. So either way, it doesn't matter. It's sort of whichever way the body asks you to put your hand. So to unwind a knee, again, I could go above the knee and below the knee, tune into the knee and start to follow it. Or I could do it this way. Now this way I like a lot if people have patellar problems too, because you can unwind the patella a little easier this way because you've got it cupped in your hand. But then with your intention, you can also project more deeply into the knee and work in the medial or lateral compartment of the knee. So this is really good for people with osteoarthritis in their knee, people that have had cartilage damage, cruciate tears. Somebody comes in with a lot of pain in their knees, you can work on them for a few minutes and oftentimes they feel a lot better for a few days. So, and then, each of the joints in the fingers can be unwound. And again, you can just go on to the joint and follow it. And again, you just put in little tiny test motions. the way to put in a test motion in cranial work is 90% intention, 10% motion. Okay? And so I'm going to put, you watch my hands, I'm going to put a test motion into her distal phalanx to test this DIC joint. Okay? Watch and see what you see. Okay, so I just put in a motion to test it, torsion along the long axis. See what you see. Yeah, I just put the motion in. Okay, that's what we're talking about with cranial level motions and stuff. Now I'm going to put in a motion to test rotation this way around that joint. See what you see. So I'm putting a stretch on the medial compartment, and now I'm putting a stretch on the lateral compartment. Now I'm moving it superiorly, moving it inferiorly. See how it does. Now when I put this test motion in, it doesn't want to move inferiorly. If I move it this way, it feels like it could go all the way to the ceiling. When I move it down that way, it doesn't want to go. A little bit tight over there. So, any joint in the body can be unwound. And how you do it, you might have to be creative. Now, how many joints are right here in the wrist? Right? Yeah, there's a lot. There's 8 little bones in there. But the main one would be between the radius and this, like 4 little bones across here. You could just unwind those. Thumb joints, a lot of people have issues with the navicular joint here, this joint here. You can unwind any of those. You can come on either side of it like this, or you can come on it like this, depending on what your body asks for. Okay. The radial head, a lot of times you can unwind the radial head like this, because it sits here, like in the end of the radius is like the end of a spool of thread. So it's a cylinder with a little rib on it, and then it's got ligaments wrapped around it so that it can rotate like that. And so you unwind the radius similar to the motion like you do to reduce a nursemaid's elbow kind of. And the elbow itself. So again, you can do it this way, you can do it this way, you can do it this way, take the whole arm off and just do the larger motion to listen to it. So from this position too, I can unwind the elbow, or I can also unwind the glenohumeral joint up in the shoulder the same way. So I've got the gravity taken off of it. Or I can do the glenohumeral joint this way. Okay. The nice thing about this is I can also do the AC joint. Okay. So what I'd like you to do then is do some listening and assessing and see if you can find a joint that's asking to be unwound, and just go there and unwind it. So again, divide up into groups of 3, and one person on the table and 2 people unwinding, and then when you get that one joint unwound, switch, and 2 people working on it and switch. So you'll get a chance to have 2 joints unwound, and you'll get a chance to unwind 2 joints on 2 different people. How you doing?